So last, we're going to go over the, kind of 4 tips that you can think about when it comes to telehealth. So again, tip number 1, you really want to understand, and you could survey your physician, survey your patients. Is this a service that is going to help your office? Is it a service that is going to increase patient volume, decrease some burden on your staff? Can it be something that you are ready to do and implement? And so really kind of sitting down with your team and going, okay, is this the right time to do this? All right, tip number 2. You're really going to want to make sure, and I know I've said this a few times, but you've got to think through the technology, making sure that you have a plan around evaluating technology systems that integrate with your software that you already use today. Make sure it's compliant for telehealth rules, and make sure that that is something that's easy to use. Next, tip number 3, something else to think about is once you're ready, right? Once you've sat down, you've gotten the process sorted out with your team, you know that it's something everybody wants to do, you've got the technology sorted, you've got your consents, you've got your process down, and the next thing is going to be making sure that your patients know this is offered, right? So have flyers in the office, have emails that go out, making sure that folks know, hey, this is a new service, this is offered, this is how, this is going to work. You can, get same-day appointments, you can schedule 15-minute appointments, whatever it is that, you've decided to implement, making sure that your patients recognize that this is a new service for you. And lastly, tip number 4 is really that you are evaluating the workflow, right? So, just because you start with a workflow that, you think is going to work, reevaluate it in 30 to 60 days. Make sure, is it working? Are we billing for it? Are we getting reimbursed for it? Are we, getting good feedback from the patients? Are we getting good feedback from our staff? And so I'm a big fan of writing things down, making a telehealth policy step by step. Here's the conditions we're going to offer an appointment. Here's how we're going to schedule those. We're going to, collect copays for those. We are going to consent patients, and then we're going to see them, write the notes, and get those billed out.